Hi, everyone. I'm Wes Williams. I'm the Chief Information Officer at the Mental Health Center in Denver. I've had the pleasure of working at the Mental Health Center in Denver for almost 13 years now. And I'm going to talk to you about the digital front door, which is definitely something that I'm very, very excited about. When we talk about a digital front door, we are not just talking about another patient portal, right? We are talking about really a new way of delivering mental health and well-being to a population, right? In this case, the city of Denver. Ellie, would you mind dropping the slide for a moment? So first I want to start with a little bit of the backstory here in terms of how we got started. We met with our board at a strategic planning retreat about 2 years ago. And at this retreat, we asked, where do we want to take the Mental Health Center in Denver? What direction should we go? And we know, right, that there's a giant access to care problem in behavioral health. About 1 in 5 Americans have a behavioral health disorder. So in Denver, we have about 720,000 people. So 1 in 5 is 144,000 people, right? And we also know that for every, 60% of people who could use professional help and treatment with a behavioral health disorder, 60% of them never receive any help at all, no services. So in Denver, that leaves 86,000 people who didn't get any help. Annually, Mental Health Center in Denver saw 21,000 people last year, which is a lot, and I'm proud about that. But I'm also concerned that we will not be able to sort of quintuple our efforts without trying something different. One of the things we discussed at that retreat is how might technology help close that gap? And the digital front door is really the sort of culmination of that work. And I'm excited to show it to you today because it's launching this fall. So with that, Ellie, can we put the slides back up? Great, so next slide. So I already sort of mentioned at a high level, the goal here is to expand access to help in behavioral health, right? We know around that 86,000 people, not all of them are ready to come into treatment, but others just have barriers to access and care, right? We needed a solution that hit both of those, right? That provided sort of telehealth for folks who couldn't ordinarily come in to receive services like you heard Anna Pham talking about in the main session, but also which offered sort of curated resources and other sort of lighter touches like you heard Aliris Allman talk about during the main session. Next slide. So we know, right, as a community mental health center, it's important to meet people where they're at. In our brick and mortar services, this means not just waiting in an outpatient office for people to come to us, but to be able to go into a community setting. Are you able to hear me, Ellie?
Yeah, Wes, your audio is just a little bit funky right now. Try speaking again.
Yeah. How's it sound right now? Great. Little blip. I saw the thing pop up, so I wanted to make sure people could hear. Right, so we don't just do outpatient services, we also offer community-based offerings and go meet people where they are with programs like STAR and Co-Responder with our home-based child and therapy services. And as we think about digitally what we want to do, we want to do the same thing there as well, right? And what we know is more and more people are accessing screens and digital content on a smartphone device. You can see year over year an increase, and this is before COVID hit. And I know from my Apple screen time alerts, I'm spending more time on the device, like an alarming amount. Next slide. So we decided to build a digital front door, which is, again, not a single thing, but a suite of services, and that we would build it for two groups of people, right? One is the people we currently serve, facilitating telehealth access during this pandemic. But a second one is a platform that provides helpful, useful content to people we have yet to serve and to our staff. So next slide. So it's a whole sort of components of things here, right? We have our Mental Health Center of Denver Telehealth App that Dr. Clark mentioned we rolled out this summer. We have the You at platform, You at Your Best, which we have built in conjunction with last year's Gift of Hope honoree Joe Conrad and his company, Grit Digital Health. We have an evolution of how we do things with our Access Center. We have our outward-facing website that you access to see this presentation today, as well as telehealth services and thinking about just how we do business differently in this sort of very digital era. Next slide, Ellie. So we don't see the digital front door as a replacement to our in-person services. And one of the things that I think sets apart our offering from other sort of online content is that we are a comprehensive solution provider, right? We have the resources to catch people if they access us digitally, but turns out that they need more, right? That is so important, I think, because telehealth is convenient, but sometimes people are in a crisis and need further help. Next slide. So again, we know that there are 86,000 people in Denver we need to reach. And that's just before you start considering that well-being exists on a spectrum, right? And that the people, like really everyone, all 720,000 residents in Denver could use our help. Next slide. So we think about the digital front door as sort of a mall. Next. In the mall, there are different offerings, right? Just like different sort of anchor stores to bring you in. And then inside, there are littler pieces that people can access. Next. So we have our front-facing website, the mhcd.org. Next. We have staff resources that we deploy internally in our staff intranet. Next. We have the virtual waiting room that we rolled out last month on the app, where people we serve receiving telehealth services can sign documents and paperwork that they would normally complete in a waiting room. Next. We have the Telehealth App itself that allows people to access care digitally. Next. We have different curated applications for people for their own well-being. Next. And then the U platform that is these sort of contains these applications and these resources that we think will be a gateway for people coming in who we have yet to establish a treatment relationship. Great, so next slide. And one more. Great, so I want to now introduce you to one of the personas that we've thought about in terms of who we want to connect with here. So next slide. So Alex is a 25-year-old Black female who identifies as queer and part of the LGBTQ community. And she has never previously been engaged in mental health services. And so as we wrap into how does this work, we want to sort of think about it from her perspective. And I think that's the last slide in this deck. If you could close that, and I'll talk a little bit about the Telehealth App. So the Telehealth App is an application we built and deployed with the help of our partners, Nudesic, to be able to show people when they have their appointments and help facilitate access to care. So if you could please show the first slide here. I think we'll pick up back with Alex. So we wanted to make sure that we could make telehealth easy. And we wanted to have this durable, right? Where it would last beyond the pandemic as something that's a useful tool for increasing access. Next slide. One of the key concepts here is inclusivity and making sure that when we build something, it's built with health equity in mind, right? And so with that in mind, we had to rethink what it meant to deliver a minimum viable product. And in this case, that meant both sort of considerations around language, right? So the app, if you have an English language keyboard selected on your mobile device, the app displays in English. But if you have a Spanish language keyboard, it automatically displays all the content in Spanish. This is a huge improvement over our previous vendor-supported consumer portal. Next slide. In addition to the language support, it has platform support, right? So we've made it available for both Apple, iOS, and Android for people. If you close that and roll the first video, the next feature we wanted to point out is the self-registration process, which just sort of ensures the security of the information and that the right people get to see their health information on the app. Try to make the process simple and easy to follow. Use industry best practices like multi-factor verification. And it's been a great partnership, not just with my team and information systems, but also with compliance, with the training. It's been a real big effort to get this out the door. We're happy to have hundreds of people. Great, thanks, Ellie. Let's see, so we've covered language support. The next feature here is, I'm sorry, I should have had this totally memorized. Is the medications list? Should run the next video. And I'll
sign a form video.
Sign a form. Thanks. So this is the virtual waiting room. One of the things that's been a huge obstacle here is that we can connect virtually, and we've been able to deliver telehealth sessions since that third week in March. But the ability to sign paperwork has been complicated. And now I'm happy to say we've made it easy. What you can see there is that we've built DocuSign right into the app. And so the forms coming from an electronic health record are presented to people, and then those folks are able to sign them, and it gets sent back and filed right in the EHR. So fully compliant, secure solution for delivering that content. The next thing I want to show you is how to initiate a telehealth appointment right from the app. If you could play that video, Ellie. Right, and so you can see we're playing these videos from a reminder that pops up. You get the reminder, 3 taps, and they're into the video session. Great, thanks, Ellie. I mentioned that we built this to last. I think the thing I'm excited about here is that even for face-to-face appointments, the telehealth app is useful. For face-to-face appointments, they can just tap through and open their own mapping application and get directions to their visit with their psychiatrist or therapist. Thanks. Yeah, so that's the app that we launched, but it's just part of the solution. The other part I want to highlight is what we learned as part of the Colorado Health Innovation community doing the human-centered design research around what people really wanted. And that was trusted, curated resources for well-being. And so that is the You at Your Best platform that we'll be launching this fall. So first I want to show what the platform looks like on a mobile device. You can see there's sort of self-assessments, there's online resources, and then there's localized content to brick and mortar connections for social well-being and social determinants of health, as well as behavioral health. So if you could run that first video, please. So you can see here, here are the curated resources. We put a little teaser out front before people sign up. As people sign up for the app, they tell us what they're interested in. So it's not just a big website of stuff that we think is interesting. It's content tailored to the individual, right? So in this case, Alex, with her depression and anxiety and LGBTQ issues, can look at content tailored for her and curated by a team that Aliris has been leading to go collect and understand what is helpful to the people we serve and how can we deliver it to the people we might yet serve. We also have a desktop view for people browsing at home. We know that the population of Denver as a whole is different from the population that we sort of traditionally have served, and wanted to make it accessible and interesting and engaging for all those groups. So if you could show the desktop version, please. So you can see here we have Succeed, Matter, and Thrive, different pieces. Here, Alex is looking for things that help with depression and can see things near her, as well as content that Mental Health Center of Denver offers in brick and mortar to help engage people. So this really is a digital front door. Some of it they can access right out here. Some folks will need no further help, but other folks we want to invite in and have them come to us on their own time. So that's what I wanted to show you today, a little preview of the content that's coming. Now I wanted to open it up for questions.
So for anybody who has a question, please feel free to put it into the chat, or you can click on the raise hand button under your participants section. I know, Greg, you had your hand up a little bit earlier, so if you'd like, you can kick us off. Is Greg still in here? Maybe not.
I think it goes straight from Harry to interpreter.
I think you're right. Clark Driz said in the chat, what capability excites you the most regarding the digital front door? I'm sure it's hard to pick.
Mm-hmm. Hey, Clark, it's good to see you. Happy you could join us. I think broadly, it's just sort of access to care, right? We know that we have to make it easy. We've been fortunate that the current emergency public health orders allow us to sort of revert to phone, but I think this will allow us to move to doing care via telehealth long term. And then in terms of the U platform, I think it's really around like this is us entering aggressively into the public population health, right? Like this is not just sort of waiting back in a sort of a traditional community mental health center way where, you know, there are other places around the country, right, where they just do office visits, right? This is taking our innovative community programs and moving it into a digital space. How can we be innovative like we do out in the community with our brick and mortar services and do that digitally?
So as I mentioned, please feel free to raise your hand. If you click participants at the bottom of your screen, there is an option under the participants section to raise hand. And then you can either say your question over audio, or please feel free to put your question into the chat. Well, Wes, while we wait, I actually have a question.
Sure.
So I know Aliris mentioned in our main video what we're doing to address the digital divide. Can you speak more to some of our efforts and how we're collaborating with our community in addressing that?
Yeah, so, you know, we're working on multiple levels there. You know, I think one, I mentioned earlier, making the software here accessible and easy to use on sort of multiple platforms. A second would be we are working with PCs for People to get needed hardware into the hands of those who don't have it. And then third is we've come out in support of ballot issue 2H, the Denver Internet Initiative, which is an important first step in making sure that we can get broadband access into all people in Denver. I think one thing that we've learned here in this pandemic is that broadband is now a basic utility. Kids can't go to school without it, right? People can't do their jobs when they've been forced to telecommute. So I think now more than ever, it's important that Denverites, you know, have access to sort of connected care.
Thank you. Marcia's question is, how will medication management services or refills be handled through the app?
So that's a great question. What I would say is in terms of refills, I think we're slating this for the November release of the app. There will be an integration with our pharmacy, which has its own app, right? So our pharmacy is part of the sort of HealthMart family of pharmacies, and HealthMart has its own app. And you'll be able to launch the HealthMart app right from your phone if you see that you're running low on medications. And the app will also have a guide around how to set up the HealthMart app to be able to request refills. In terms of medication management, you know, I think that's where I would anticipate that people might have an appointment to come in and have a reminder come up on the app, and that would show them how to get to our facility to receive their meds.
Beautiful, thank you. So we are at 1 o'clock, so we are at time for our event. I want to thank everybody for joining us today, and thank you so much, Wes, for hosting this event, and special thanks as well to our interpreters, both Spanish and ASL, for doing the work to make sure that this event and others are accessible. So please watch our Gifts of Hope webpage for future events, and thank you again.
Thanks, Ellie. Thanks, everyone, for coming. I'm really so happy to see you.